Hi everyone, thanks for joining us this afternoon. My name is Lauren Pasch and I'm the theory-genologist here at Rhinebeck Equine. In this little talk today, I want to focus on the performance mare and some of the possibilities that exist for producing offspring from her during her competitive career. I hope you're going to find this information useful, and I will be available as part of the live Q&A panel at the conclusion of the scheduled presentations today. This slide is a general outline of what I want to go over in this talk. Basically, it boils down to how we can work to breed your performance mare, regardless of the discipline. We will get into a little bit more of the medical side of things in the last half so that hopefully you as an owner can be armed with the information to make sound decisions, and also so that you understand what diagnostics we may be performing and why. So I wanted to do this talk today because I think that there are a lot of opportunities for mares to produce offspring while they are still competing, whether it's dressage or eventing or barrel racing, some of the Western disciplines. In the sport horse world, we do have a distinct advantage over thoroughbred mares just in terms of what their athletic career entails and also the opportunities we have for reproducing. And another thing is that COVID really, I think, pushed a lot of people to breed mares when that wasn't necessarily their plan ahead of time. And I think even though we're hopefully going back to some sense of normalcy and shows will be happening, mares will be competing again during this season, it doesn't mean that we have to abandon all reproductive hopes. I think one of the primary concerns for owners is whether breeding will have an adverse effect on performance in the show ring and vice versa. The short answer to both questions is that it doesn't have to. Here I'm just going to go over what I see as some of the issues we need to consider when we're planning to breed a performance mare. There's a lot of overlap between these issues, but basically we're talking about fitness, nutrition, and other systemic factors. I tend to find nutrition and body condition score to be pretty well and closely monitored in performance mares because these animals are athletes and they tend to be maintained fairly intensively as a result. So going to the first question here that I have listed is, will showing have an adverse effect on fertility? So I'm just going to go through some of the ways where we might see an impact. Doesn't mean we have to, but just some considerations to have. So heat stress is something that I mention. It's really only a concern in the earliest stages of pregnancy. There are a handful of studies that have looked at whether increased body temperature is going to have an adverse effect on development of the early embryo. And the general consensus is that mares are not likely as sensitive to heat stress as dairy cows, for instance. However, during this very critical time of fertilization and early embryo development, which is basically the time between breeding and flushing an embryo, or the first 7 to 10 days of a potential pregnancy, excessive activity, exercise, working if it's really hot out, should be avoided if possible. And we're talking about a very narrow, short window when that would be the case. Stress in general is not great for pregnancy just because it's going to lead to increased cortisol. Pregnancy is also not probably the time to try new things with your mare necessarily, just in terms of challenging your riding and moving up a level. And one big thing is the logistics of showing or training, and that schedule is probably going to be the biggest challenge and potentially detrimental factor. And then for the follow-up question, how might pregnancy have an impact on performance? Medications are a big category to think about, specifically steroids. So talking about a performance mare, we don't want to be doing, intra-articular steroid injections during pregnancy. Again, as with the last little point, pregnancy is not the ideal time to start moving your mare up the levels. But at the same time, pregnancy is not a fragile state. Ultimately, though, everything that impacts your mare can also impact her foal. So in terms of riding while pregnant, maintaining fitness is very important during pregnancy. And what I usually recommend to owners is that your mare can continue to perform at the level she's used to for as long as she's comfortable doing it. Routine is everything. You don't want to take your Grand Prix dressage mare who's used to, daily training and throw her out in a field or just stop riding her cold turkey. Most mares let you know when it's time to back off a little bit or stop riding. And eventually size is going to be the rate limiting factor. The foal does most of its growth in the last few months of gestation, and so the mare's physique is going to change correspondingly. So don't get overwhelmed by this image here, but I just wanted to briefly mention sort of the basic physiology of the estrus cycle in the mare, just so that the next few things I'm going to say make more sense. But the estrus cycle in the mare lasts on average 21 days. Typically 5 to 7 of those days, or about 1 week, is going to be estrus. So this is the time when we want to be breeding her. And then the other 2 weeks of the estrus cycle are what we call diestrus, and that is not when we want to be doing most of our diagnostics. It's when your mare is going to be out of heat. There are a few procedures we will perform in diestrus, most notably embryo flushes, but typically that's a time of sort of uterine quiescence and we're letting things settle down. So big question, how do I prepare my show mare for breeding? Ultimately, it depends. It's very mare dependent, like so many things. Across the board, obtaining a thorough medical history is going to be the first step. Specifically, what medications is your mare on? Regemate or Ultron is probably the most common. Misoprostol is fairly prevalent in certain breeds, as are some of the Synovex implants. Thankfully, that's becoming less common. One question we don't always think about is, does your mare have an intrauterine marble? Along those lines, just make a quick side note that although I don't want to get into a long discussion on estrus suppression, if your mare is on Regemate, for instance, in order to suppress estrus, pregnancy is a very effective means of estrus suppression. So that's sort of a 2-for-1. So what mares are going to need a more thorough pre-breeding exam? A lot of people talk about before you breed a mare, you have to do a full breeding soundness exam. And this is a bit nitpicky, but a complete by-the-book breeding soundness exam, or BSE, is fairly extensive, but we can pick and choose what is going to be relevant for each particular mare. For any mare who's a breeding candidate, we're going to start with a physical exam and then palpation and ultrasound of the reproductive tract. The most basic level of information we're looking for here is that she has a normal reproductive tract with 2 ovaries. But I'm also screening for any abnormalities or any red flags. Uterine size and tone, is there any intrauterine fluid? If so, how much? What does it look like? And the next piece of information that we gain from this ultrasound is what stage of the estrus cycle is she at. And this is important in terms of knowing whether she's cycling and whether she's a diestrus or estrus. We want to see if our findings are what we consider normal for that phase. And if your mare is not young, and in this case, when we're talking about breeding mares, we typically say early teens is when they start to, have declining fertility as a result of age. So here I'm talking about mares in their early teens and older. At the very least, we're probably going to want to do an intrauterine culture. It's a quick, easy, non-invasive diagnostic tool that can really save us a lot of time and money and headache down the road. So in these next few slides, I'm just going to go over some of these basic diagnostic tools that we might use in getting your mare prepared for breeding. So endometrial culture, as I mentioned, is one of the most common diagnostics that we're going to use in a broodmare. And for me personally, if I'm going to do a culture, I like to also do a cytology. So I'm getting a more complete picture and really all the information that I can by performing these two in conjunction. So we're talking about culture. Basically, we're taking a double-guarded swab. You can see a little diagram of this here in the corner, and passing that swab through the mare's cervix into the uterus and basically getting a sample of that inner lining of the uterus. As you can imagine, we're only really targeting one small area of the uterus when we do that. So another option, which we may decide to use in certain cases, is a low volume uterine lavage. And same idea as a double guarded culture swab, but we're actually putting a small amount of fluid into the uterus, retrieving that after sort of mushing it around the entire surface of the endometrium, and then we can get a much more sensitive representative sample. When we are doing these cultures, typically we're looking for aerobic bacteria. The big four tend to be Strep equi, E. coli, Klebsiella, and Pseudomonas, with those top two being definitely the most common. Occasionally we'll see weird, frustrating things like fungus or yeast. And then cytology is something we're going to perform at the same time. Similar technique, except we have this nice, very soft bristled brush, and we're basically getting a bit more aggressive sample of the endometrium that will be stained and looked at under a microscope for cell types. Sometimes we'll actually see bacteria or fungus, and we can look at what the inflammatory cell numbers are, and really just get a much more complete picture than if we did culture alone. So this is just a magnified image of what we might see on cytology. So as you can see with the labels here, these sort of big oblong purple guys are the endometrial cells. So these are the normal cells that are in that inner layer of the uterus. Inflammatory cells, so neutrophils, white blood cells. And then occasionally, like in this nice little picture, we can actually see bacteria within those white blood cells. And the other pre-breeding diagnostic tool that I just want to touch on briefly is endometrial biopsy. Basically, we're taking a long-handled forceps and taking a more aggressive than in the culture or cytology sample of the endometrium, which, as I said, is that innermost layer of the uterus. There's no nerves in that layer, so although this may seem fairly aggressive, it's not a big deal. And there's a very well-established grading system when we're looking at these biopsy samples. So basically we're looking for inflammation, which can indicate infection. And we're also looking for fibrosis. So how constricted, if at all, are these glands within the inner layer of the uterus that are going to be really essential in maintaining a pregnancy. I try to be fairly judicious in terms of which mares I biopsy and which I don't. The cases where biopsy is going to be most useful is if we're trying to decide if your mare is going to carry a pregnancy or if she's a better candidate for embryo transfer. Which brings us to the next point. Embryo transfer, do you want to flush an embryo out of your mare or are you going to breed her to carry? So some of the big reasons to do ET or embryo transfer, the top two there, training and show schedule, are just really the logistics of it all. You can breed your mare, flush her, and then she can go on with her career, her show schedule, her training, travel, whatever it may be. It's also a good option for people who may be extremely risk averse. Pregnancy is always going to be a risk for the mare. And if this is your heart horse and you are just not willing to put her at any sort of undue risk, then maybe she would be a better candidate to flush an embryo from. Mares who have anything in their history that, might make us lean towards flushing an embryo from her would be a history of prior full rejection, severe endometrial fibrosis, so that's something we would see on the endometrial biopsy, like I just mentioned, or if she's a history of dystocia and has had some sort of, significant damage that is going to make carrying a foal or delivering a foal unwise and risky. So when we do flush an embryo, we have a couple of options what to do with that embryo. We can transfer it immediately, and that's going to be the preference. And by immediately, I mean within a day or a few hours. So we can either ship that embryo to a recipient herd, There are many, and we here at this practice are happy to sort of help you go through the steps of getting a contract set up with a recip herd and how that works. The other option is to have your veterinarian synchronize another mare who can be your local recipient. Not every mare is going to be a good candidate for a recip. Just because you have an extra mare kicking around in the back 40, a 20-year-old, maiden mare with bad feet is not going to be a good candidate to put this embryo into. We want recips who are young and healthy and reproductively proven, ideally. And then the last thing I have on here, just really as a reminder to mention it at the end, is vitrification, which is really just another word for freezing. I should put a little star next to that because although we can freeze embryos, it's not typically what we want to plan on doing. And just for more information here, this image here is of an embryo. This is probably about 8 days, and this little dark area right here is the inner cell mass that's going to become the actual embryo proper. So a little bit more on embryo transfer, because performance mares are really, really great candidates for embryo transfer. The basic technique, so this is one of the few or only things that we're going to do when the mare is in diestrus. Basically what we're doing is taking a catheter here and introducing it into the uterus. We have a closed system, so we're flushing this flush media into the uterus and then back out. And on the way back out, it flows through a 70 micron filter, which is small enough that it will trap any embryo that we may recover, and then we can search for that under the microscope. So continuing on with embryo transfer, we'll talk primarily about managing the donor, because that is, in this hypothetical situation, your mare, and then just a little bit on how we manage the recips. So basically for the donor, it's standard breeding management, but if there was ever a time to be extremely nitpicky and pay very, close attention to timing, do everything, to a T, this is the time to do it. We want to make sure that we are confirming ovulation, and that's really for timing purposes. And then typically we flush the mare 7 to 8 days after she ovulates. If she's been bred with frozen semen, we might do our flush on day 8, just so that the embryo has a little bit more time to increase in size, because those frozen semen embryos may be a bit smaller. And typically if you're using ship semen or fresh semen, we'll do the flush at day 7. After flushing the mare, we always want to give her prostaglandin to make sure she does come back at the heat. And this is really to prevent her from becoming infected, because we have manipulated her uterus quite a bit during this time of her cycle, diestrus, where we're not typically doing that. Management of the recip, I already touched on a bit, but we want mares that are young and fertile and sound and healthy. Again, it's going to depend on the veterinarian and the mare and the owner, but we want to make sure at the very least she has very good vulvar conformation. If we biopsy her, we want her to have a pretty healthy looking uterus. Obviously, we want to make sure she has a clean culture, because when you go through all of this effort and time and money to obtain an embryo, the last thing you want to do is put it into a uterus that's not going to be a good home for it. And in terms of synchronization, this is something that can get a little bit tricky. But I don't want to speak for other veterinarians, really enjoy the challenge of trying to sync up these two mares. But basically the recip needs to ovulate within 1 to 2 days after the donor does. So we're talking about, very tightly managed schedules for both mares. And I just want to come back real quick to this number here that we're flushing at day 7 to 8 post-ovulation. So that 7 to 8 day period between breeding and flushing is when a lot of mares will go home and go back to their regular life, and then they come back to the clinic for the flush. And owners are always wondering, can I ride her? Can I show her? Can I do things? And I'll never tell an owner, no, you absolutely can't ride your mare. We just don't have the information to support that. However, especially if it's in the middle of summer, it's really hot. We just want to avoid excessive heat stress and other stress. You don't want to be putting your mare through rigorous exercise and trailing her all over the state or the country during that 7-day period. And it's a small enough window that we're usually able to work around it in terms of schedules and logistics. And that's just one of the reasons that embryo transfer is such a great option for these performance mares. All right, so while we're on the topic of assisted reproductive techniques, I just want to touch a little bit on some of the other options we have beyond embryo transfer. And really, these are for mares that, based on that biopsy or culture or other historical information we may have, don't really have the capacity to support an embryo even for that 7 days before we flush it. So those mares are going to potentially be candidates for TVA and ICSI. So TVA, here in alphabet soup, is transvaginal aspiration of oocytes. And ICSI stands for intracytoplasmic sperm injection. This is basically the horse version of IVF. And for reasons that I won't go into here, we can't do sort of the standard IVF that we do in other species. So basically, in a nutshell here, we're taking an ultrasound probe with a pretty significantly sized needle on it, and putting that into the vagina against the vaginal wall, and then an arm comes in transrectally to pull that ovary so that it's right on the other side of the vaginal wall, and line it up with the follicles. A needle is punctured through the vaginal wall into each follicle, and we flush that follicle and sort of move the needle around and agitate things, and hopefully we're retrieving an oocyte or an egg from that follicle. So this seems like fantastic. It's in and out. It's a 1-day procedure. Your mare doesn't have to carry a pregnancy for any period of time. But, and this is a bit of a soapbox issue for me, these are fantastic tools that we have. It's really amazing that we can create embryos this way, but it's not a benign procedure. There are risks, significant risks associated with it, and it's quite painful. Not to say that there are not mares for whom this is the best option, but it's really not the end-all be-all. And the mare who's really a good candidate for TVA and ICSI is, as I said before, mares that are truly unable to produce an embryo for transfer even. This is not something that we want to do on young, healthy maiden mares for the convenience factor. And some other considerations just to keep in mind if we go down this road is the cost. And also on average, it's not super successful. We are still, as a profession, doing a lot of learning about what makes this work in certain cases, what makes a good oocyte, what makes a good sperm for this process. But, it's case selection is very important, is really what I have to say about TVA and ICSI, and something that we can absolutely discuss on an individual basis, but I think there is sort of a misconception out there in the world that this is a quick, easy, get her in, get her done, she can go back to her show. And I would just say that that's not necessarily the case. So coming back to this point that I just brought up before and wanted to make sure I mention, can we freeze embryos? Can we freeze eggs? In terms of freezing oocytes or eggs, nope, we just can't do it yet in horses. We can freeze embryos, but there are some special characteristics of the equine embryo that makes freezing them a little bit harder than in other species and a little bit less successful. So again, without going into all the details, because that's beyond the scope of this talk, two main factors that make it hard to freeze equine embryos are their size. It's quite large compared to other species at this stage. And there's also this very unique protective capsule around the embryo. The only situation where we really recommend freezing embryos is after oocyte aspiration and ICSI. So in the best case scenario, you do get multiple embryos from one of those sessions. Those embryos tend to be quite small and they don't develop the capsule. So we might have more success freezing these, but in general, it's not something that we want to bank on. It's not, unfortunately, the best way to sort of store genetic material for the future, just because it's not going to be as successful as transferring a fresh or a shipped embryo. So that kind of abruptly brings me to the end of this talk. I will, as I said, be available for questions and comments after the scheduled presentations are done. And I'm always available as well via email and, through contacting the office. But I hope that this has given owners of performance mares, a little bit of food for thought that we can absolutely breed your mare and produce offspring while she is still in the prime of her athletic career, rather than the, I would say, more typical path in the US of waiting until a mare is retired. And our fertility might be a little bit less robust than it was earlier in her life. And, we have a fit, healthy, well-maintained animal, and this is as good a time as any, in my opinion, to try to breed her. So thank you again for listening, and I look forward to answering your questions a little bit later today.